It has been nearly a year since we could see our loved ones in long-term care facilities. Even with vaccinations, there's still a lot of stress and uncertainty, thinking about a loved one and what happens if there is an outbreak. Kristen Goodwillie tells us about a partnership between UofL and Eli Lilly that aims to help our most vulnerable populations.
When we look at our most vulnerable populations in Kentucky, those in long-term care facilities are being hit the hardest. Those in older age groups are our parents, grandparents, and friends. That's why UofL Dr. Ruth Carrico says researchers with the University of Louisville are working on a clinical trial with Eli Lilly to prevent the spread of COVID in older age groups.
We are committed to saying whatever it is that may save this population, that's what we want to do.
Since November 2020, researchers have been working to help Eli Lilly disperse a monoclonal antibody treatment to people testing positive for COVID-19. Dr. Carrico says using antibody treatments like BAM have long been used to treat infectious diseases. The difference here is that the antibodies are made in a lab and don't require plasma. That's so important for older populations because the plasma has been linked to blood clots, which makes someone with COVID at higher risk. Though the researchers have only been helping this third phase of the clinical trial, the data they have so far is promising.
Being able to work very closely in real time with clinical research is an experience that we don't get very often. And as you know, anything that we can learn that will give us a leg up on this virus, we want.
If you have a loved one in a long-term care facility and want to sign them up for this process, if they were to test positive, Dr. Carrico says to call the facility first and then talk to them about it and let them know you want this treatment to be the first line of defense. I'm Kristen Goodwillie, WHAS 11 News.